being down in Texas, and I know this is in other parts of the country, I wanted to talk about something that it hit me the other day. Cultural impediments to care.
Oh, okay. That's a big one.
But I think you're almost the perfect person to explore this topic with, because if I remember right, you mentioned your dad had 14 siblings.
Mm-hmm.
You have a lot of cousins,
including himself. I have way too many.
But they're from different countries too, because your mom's from Bolivia, right?
Mm-hmm. Mom's from Bolivia. I have other cousins that are mixed with Caucasian, some cousins that are mixed with Puerto Rican. So it varies.
And but your family lineage goes to Puerto Rico, Dominican Republic, Bolivia, Mexico.
No, not Mexico. My husband's from Mexico.
Okay, well, okay. So you have this United Nations background, but each one of those countries is practicing medicine a little differently. And here's the thing that sparked the thought. In Panama alone, during the helicopter life flight, I had the pleasure and honor of working with a terrific physician at the Children's Hospital, the Hospital del Niño here in Panama, Dr. Alberto Bisot. I call him Santo Alberto, and there's a story behind that. But Dr. Bisot was the director of the hospital. And so one of the things that we were looking at doing were flights, doing flights for kids. He said, you're going to have a problem when you go into the Darien. And the Darien jungle is east of Panama City. It's the eastern part of the country. It is the densest jungle on earth. Makes the Amazon look like Disneyland. And so, he goes, you're going to have a problem because you're going to be landing a helicopter and you're going to be dealing with the local shaman, the doctor.
Okay, like the town, the doctor of the pueblo is what you're saying.
Well, no, I'm talking the tribe.
Oh, the tribe. Okay.
We're talking, people up in the United States would go, yeah, witch doctor. So shamans or shamans, anyway, these are the local medicine people that they've been using herbs and roots and, and they've been at it for 1,000 years. So it's been passed down from one to another. We're talking tribes. Right. And he said, we had problems that took a long time to overcome because we would go in and the shamans would be like, no, you can't take this baby. We'll treat them here. They didn't trust Western medicine. And it took a long time for them to become trusting that you're going to take them in that Jeep or that helicopter. When do we get them back? And sometimes they wouldn't come back because things happen.
Right.
So he said, I want you to know that you're going to have to do some flights and meet with the tribes and meet with them and show them what you do. And I had not a clue that was on the calendar. Oh, okay. We need to do a lot more community development, relationship work. So that's what got me thinking about in Texas and Houston, you have people from all over Latin America.
That's right.
And you have their perceptions of medicine. They know they're not there legally. And this is a segment of the population, a fairly significant one. They're afraid of popping up in the radar screen.
Absolutely.
And this is a big problem because what do? CNN had a clip on it. I'll put it in the notes, in the description, about a 55-year-old man who is there, been in the U.S. for 20 years or so, illegally. And they asked him, what do you do for healthcare? He goes, I rest. If I feel bad, I rest.
That's heartbreaking.
Doesn't know if he has high blood pressure. But the key here is when he finally goes for healthcare, where do you think he's going to go? He's probably going to go to the most expensive parts of the
ER, because that's all he knows.
Right. And yes, there are some elements to care that they can access. There's a very big disincentive even if you have free health care, even if Medicare for all said, no, no, you can go, they're not going to go because it's the system and they don't want to
Right.
be popping up on that radar screen. And this happens in other countries. It happens in Canada. They have a national system there. They don't go there either. They're not sophisticated enough. They don't have the education. It's ignorance. It's not stupidity. And they've been told within the community that they're in of people who have been there prior. So you have a couple of cultural barriers. They don't want to pop up in the radar screen. That's a big deal. DPC is a significant solution waiting to happen so that we can prevent people from popping up into the ER when they could have been treated long ago by you.
Right.
Right? So I'm giving you kind of the background of what was going through my head. And I hope the audience indulges me on that one because it's something that I know is an issue from one standpoint.
So I actually have a couple of things to say. My mother and her family, there was the tribe doctor, okay? And my mom likes to, instead of taking any type of medicine, she prefers to do everything natural, okay? And there's nothing wrong with that, right? As long as there's evidence behind it. So I call her, Mom, you're a witch sometimes, because for any ailment, okay, that I can tell her, Mom, I have a headache. Oh, you have to drink this tea. Mom, my hair is too dry. Now, mind you, my mom is native. She has straight hair, and look at my hair, it's curly because my dad's a Black Dominican. My mom's from Bolivia. So she's like, oh, mija, you gotta put egg on your hair. You gotta put aguacate. And I'm like, oh my God, this is crazy. But a lot of these remedies have worked, okay? And the reason she knows so much about this is because in her family, I don't remember, it was a great uncle or her grandfather or something of that sort that was very well versed in this. And people, she says as a kid, she remembers people come to her house, and for burns, I think she told me that they would put they would take aloe vera, they would peel it and put it on burns and things of that sort. So I think there is a cultural barrier, one, because they feel like they can treat things in a natural way, and they see that that's superior to traditional medicine that you can give for an ailment. That's number one. Number two, a lot of times these people like my mom or some Hispanic or Latinos, they feel like their problem is not severe enough to warrant to go visit a doctor. So they're like, well, I'll take care of it with, so-and-so told me that I can drink this tea for that, and I'll do that first. And if that doesn't help, then I'll go see the doctor. Other barrier is that the educational status of the patient. So if they have a lower education, they're most likely not going to seek help. There's also a financial barrier. Going to the doctor is expensive, usually, right? And that's why direct primary care is beautiful, because it works very well for people who have no insurance. And it also works well for people who have high deductibles. You will have access to your doctor, and that doctor will get to know you one-on-one. And the beauty is that you'll be able to, as a physician, I will prevent you from XYZ because of, the monitoring that I'm able to do, okay?
Right.
Something else that I noticed, me being, Latina, Hispanic, Black, all of that, because that's all me, is the culture behind going to see your doctor. Most Latinos and Hispanics like a very intimate relationship, right? Because we're usually people person. So we're very welcoming, and we want that relationship with our doctor. Unlike the traditional American healthcare system, often doctor visits are very rushed, and patients tell you that they're not listened to. And they tell you that because of that barrier in itself, they're not able to open up and speak, okay, to the doctor, because they feel like it's not personal enough. They feel like it's too rushed, and they feel like they can't establish that rapport and that trust. So let me give you an example. When I was a resident, I remember the majority of my patients used to kiss me. So now, because COVID, we don't do any kissing, we don't do any hugging. And it's hard because that's part of my culture. You know, you see someone, oh, how are you? Mwah, and you hug them. So now we don't do that. And I remember that was actually brought up, that that wasn't considered professional. And I said, well, my God, how is that not professional? If this patient, you know, comes towards me and gives me a kiss, I'm going to accept that because that is culturally acceptable for me. Okay, so imagine if you don't have that trust with your doctor, okay, that you can't tell your doctor anything. And I'm going to give you a real lifetime example. I have a very close friend that I consider her a cousin. She married a Lebanese guy. They've been married for a very long time. And the mother-in-law, who only speaks Arabic, would go to her doctor all the time for her diabetes and blood pressure check. Now, they live in Dallas. And never once did that lady mention to her physician that she had a problem with her breast, okay? There was that language barrier, which is a big thing also, because if you're not able to express yourself exactly how you feel, well then I as a physician will not be able to understand you, okay? And that may limit the care that I provide. So my friend tells me, I have to show you something that has been omitted every single time we take my mother-in-law to the doctor. And I go, what has been omitted? She keeps talking about breast pain. So I'm on the phone with her and I tell her to show you her breast and take a picture and send it to me. Maybe I see something. And she did it without hesitation, right? She took a picture, she sent it to me. When I saw a picture of this breast, I said, it's cancer. And my friend goes, what do you mean? I go, look at it. It was a picture of her breast, this lady in her 70s, and it had masses growing around and discharge. Now, mind you, this lady had always gone to her doctor every 3 months for her diabetes check, for her blood pressure, for her cholesterol, and not once mentioned it to her physician. Why? Because there was a language barrier, because she felt embarrassed, and because the other big thing was that doctor was a male. Okay, and she did not, because of her, you know, religious beliefs, she did not want to show him her breast, even though she's been suffering for that for months. So my friend told me, how long do you think she's had that? I said, well, that looks chronic. That's been going on for a long time. Well, it turned out, unfortunately for her, that it was a cancer. This happened about a year ago. And when I looked at the picture, I could not believe what I saw. These are the type of things that I would see as a medical student in the Dominican Republic. I mean, this woman had insurance and she had Medicare, but because of those barriers, she did not seek help. And on August 2nd, this lady passed away. You know, she did receive, she received chemo, she received radiation, she had a mastectomy done. She ended up with home hospice, and palliative medicine. So she passed away very peacefully. But it's very sad to me because something that could have been prevented with a mammogram or just doing a breast exam went undetected. And had it not been because my friend, like I said, I consider her a family member because I've known her since I was 5, you know, made me aware of this, I wouldn't have known, you know, not even her son. And they lived in the same house, like the mother-in-law lived with my friend and her husband. So it was just very, very sad. And it's happened so many times. I can share a couple stories like that, but this is the one that's hit closest to me because I've known that family for such a long time, and that lady just was the sweetest, you know. But those are, again, barriers to healthcare, and that should not happen. So whenever a patient feels very comfortable with their doctor, when they feel like they know you, I try to establish that relationship with my patients, that, you know, you can ask me things. Don't be embarrassed to ask me any questions. If you don't understand it, I can explain it 3 other ways. And what I do is when I'm done explaining something to a patient, I have them repeat it to me. And they're like, why? You just told me. I go, because you're going to go out the door and your wife is going to ask you what I said and you're going to say, oh no. I was like, so I don't want that. So what did I just tell you? So then they repeat it to me. And then when they repeat it to me, I'm able to assess if they understood the material that was presented. You know, once you have that relationship with that patient and they know you very well, they feel comfortable, they're able to share things with you that otherwise they would not have shared. I mean, I've had patients tell me, more than anything, patients tell me how they're intimate things. Like they're embarrassed to say, I have, I have never experienced an orgasm, or I think there's something wrong with my hormones because, having intimacy with my husband does not feel pleasurable. It feels like a chore. The other big thing that's a big taboo and cultural, I feel like it's cultural, especially in the Hispanic Latino community, is talking about mental illness. Okay, that's a big one, because when they tell you all these things, well, first, they always think that there's nothing wrong. And when they feel like there's something wrong, but they just can't quite point it out, and they come see you and you tell them, I think you're going through a depression. Not me. I'm not crazy. I'm like, wait a minute. I never said you're crazy. I'm just saying that it seems like you're depressed based on your symptoms, that there's a neurochemical imbalance in your brain, and that's why you're feeling that way. And I think it'd be a good idea to start you on medicine. Oh, no, because then I'll get addicted. I don't want the medicine because I don't want my family to know. And what I tell them is then, what is the difference if you had pneumonia? You get treatment with antibiotics, pneumonia is gone. If you're a diabetic, you get, you can get your metformin, you get all the drugs you need for diabetes. So what is the difference between something that's like mental health related versus something wrong in your body? They're like, nothing. So that's the point. There's nothing. I want you feeling good. I want you being at your baseline. I want you living a good quality life. So I don't want you living like this, okay? And for a lot of Latinos, admitting that they have some type of mental problem going on takes a lot of courage. And it does not happen you can't tell that in a rushed 15-minute visit. Okay, you just don't know that, because people are very good at hiding things. But then when you notice that patient comes in and they're not acting the same, they are not, the way they look at you, or just their body language, you ask him, is everything okay? And that's all it takes. You don't have to tell them, you look a little strange. Is like, what's up? I just look at them, and I look at them in the face, and I'm like, this is what I tell them. Like, is everything fine? Just know that you can count on me. And when I say that, like, they start crying, they start telling me what's going on, and that feels good that they trust me, and I tell them, I am a physician, I am not a magician, okay? So I can't solve your problems with a magic wand, I can't, but I can try to help you resolve them. This is a two-way street. I can teach you, okay, but you also have to put some effort on your part. Okay, so, and we have these conversations. We have conversations about compliance. We have conversations of, there's no point of me giving you medicine if you're not going to take it. I can't go to your house and give it to you. You have to take control of what's going on within and understand I have to do something about it. So that is something that DPC has provided that in a traditional office setting, you really can't do because time is so limited.